in physio, when we get an hour with people sometimes, and that's usually how much time I'm fortunate enough to have with my chronic pain patients, that we can start hearing their story and their humanity coming through. And it's hard not to just want to say, what are we doing as a healthcare system when you hear all the stuff that's surrounding somebody's symptoms, yet we are still bucketing people off into little separate pieces of a machine, which people aren't. We aren't just parts of a car that we can have one person look at one part of the car, one person look at the other part of the car, one person look at the other car and fix it, and it's all going to end up well. Would be nice, I guess, if that worked, because then healthcare would be knocking it out of the park. But of course, that's not what's happening. So we need to have skills to be able to have difficult conversations and ways where we can help the patient explore their own journey and explore how they're approaching things. So one of the first things we want to understand with them is to say, are we trying to use treatments for what? Are we using them to get back to what matters, or are we just trying to get pain down? A lot of times patients are on I just need to get my pain down so then I can. I need my pain to go away so then I can. It's not usually using treatments often where I'm using it so I can get to golf tomorrow or I can pick up my grandkid tomorrow. It's those things are all on hold. Those things aren't even in my thought process. I need to get pain to go away first, which again can be a delicate topic to touch on. And that's where you have to have skills such as creative hopelessness and things to help people explore that pain eradication approach and how it's went. And is it really truly moving them towards where they want to be? Other questions you can ask the person is, hey, are you becoming more confident and capable, or do you feel like you're becoming more dependent? And are these treatments giving you more of life, or are they giving you more appointments? And I think as you get rapport with people, you can have some frank questions that maybe hit hard a little bit, but as you've developed some rapport with somebody, you've shown that you care and that you're on the same team and that you want to guide them to a better life and better way that they're interacting with their pain, that some of these questions can be some tough ways for them to have to look at their approach. And maybe sometimes when patients are just on autopilot with just trying to survive and keep their head above water, they don't even recognize some of the thought processes behind their approach. So very helpful to have some strategies to dig into that approach and see if they can explore it. And then as a guided discovery, what do you make of that? Do you feel like it's really moving you to where you want to be? Or do you feel like this is an approach that's really giving you the results that you want to have? Not we're telling them what it's giving them, you're letting them explore what they feel they're getting out of it. So as a clinician, we facilitate these conversations by having conversational skills, motivational interviewing, guided discovery methods, understanding some roots of acceptance and commitment therapy and other psychologically informed approaches.